Hi, this is Neuron Ron for NAMI Montana. We want to say thank you to all the veterans and their families on this Veterans Day. NAMI Montana works with a lot of veterans. We're really honored to do so, and we have 5 steps that we think would improve the mental health care for our nation's veterans. First, wide-scale adoption of deep transcranial magnetic stimulation throughout the Veterans Administration. Deep transcranial magnetic stimulation is an FDA-approved treatment which cares for people with treatment-resistant depression. This is a major population that is not currently being cared for properly by the Veterans Administration. Deep TMS would help that process. There's also positive research findings suggesting that Deep TMS could be effective for post-traumatic stress disorder, anxiety disorders, bipolar disorder, substance abuse disorder, and certain types of dementia and Alzheimer's disease. In fact, NAMI Montana is working with the Center for Mental Health Research and Recovery to do testing on the effectiveness of Deep TMS for Alzheimer's disease. And we think that this is exactly the kind of program that could be helpful for a lot of our country's vets. This treatment is cost-effective with minimal side effects and minimal impact on clinicians' time. Second, we would like to see a 10-year goal to adopt a functional brain analysis as part of the VA's screening and diagnosis for brain conditions. Brain conditions such as mild traumatic brain injuries, post-traumatic stress injuries, mental illness, and dementia are often missed through traditional questionnaire-based diagnostic analysis. Research-grade technology is currently in the pipeline that identifies red flags in neurovascular coupling, which is electrical and blood flow in the brain, that may be evidence of a brain condition that requires specific care. The VA should be proactive in getting the most effective type of this technology commercialized and implemented in VA clinics in the next 10 years. Third, compensation rates for private VA providers should be at least as high and broad as Medicaid compensation. The VA is beginning to use more private medical providers to care for veterans through the Veterans Choice Program and other options. These programs are generally managed by private companies acting as third-party administrators. The VA needs to be absolutely clear to its private contractors that they cannot offer reimbursement rates lower than state Medicaid. That is the absolute basement. These services should also be at least the same services as Medicaid. Fourth, the VA should partner with the national pet chain to offer training classes to help veterans train their own psychiatric service dogs. The VA has taken great steps over the past 2 years to ensure access to psychiatric service dogs at VA facilities. However, the VA does not have a nationwide program to help veterans access service dogs. Patient-trained psychiatric service dogs can be incredibly effective and sometimes more effective than service dogs trained by outside organizations. Service dog users have to conduct their own training in relation to an obedience dog training program, but much of the psychiatric-specific training can be done on the job with minimal guidance. A national pet supply chain with an existing dog obedience program would be a natural partner to help veterans train and effectively care for their own service dogs. This would be a major step for the VA to help offer this critical service. And fifth, the VA should create fun and engaging exercise options for both healthcare treatment and incentive purposes. The effectiveness of exercise in improving mental health conditions has been well researched and proven. Exercise should be easily available and even prescribed for veterans with mental health conditions. The VA will need to take an active role in ensuring that veterans have access to effective and engaging exercise options. While the cost of providing these exercise services will not be minimal, they are reasonable when compared to other psychiatric treatments such as medication. The available of exercise options to this population may also reduce long-term costs in diabetes, heart disease, and cancer care. Thanks again to everyone who has served in the military, the men, women, and the families. NAMI Montana deeply thanks you for your service. Let's improve the VA mental illness treatment system for tomorrow's veterans as well. Thank you.